What would be your most urgent needs right now to help save lives at your hospital?
We have around 200 beds in the hospital. In the male ward, female ward, each has only one patient monitor. Ideally, every bed should have a monitor. Next is defibrillators. This year so far, we've lost 3 mothers, and the last one we lost this month. If we have proper anesthesia machine, proper monitoring, proper defibrillation, would have saved it. If it was a different country, the woman would have survived. Then we're also losing the babies. Every week we lose 1 or 2 babies, and which is a problem to us.
Yesterday, we were crying because we were at a hospital that SOS had helped and babies were being saved. Today, we're hearing, because we haven't been here, the babies are dying and we're crying again. It's just totally different tears. We're gonna help you. I will find a way. I will find a way.
What if the items we toss away had the power to change a life? What if the resolve of a group of people in Louisville could create lasting impact across our city, our state, and our nation? What if this transformation of health and hope could span continents and languages for generations? This impact is possible. It's happening, and it's called SOS. Every year, SOS collects thousands upon thousands of medical items that otherwise would have been thrown away and responsibly redistributes them to improve health and communities around the world.
SOS is a global health organization, and global includes local too. Whether that means the world or Jefferson County, Southern Indiana, it's our neighbors everywhere.
SOS has been a strategic partner. They have not only helped us with the equipment, they have helped us connect with other people in the community.
No animal enters the shelter with a good story, but with the help from SOS and the medical care that we can give them to turn their lives around, they have an opportunity to start over with a new family.
When we knew we needed more supplies, we knew to call SOS. These supplies would probably be going to landfills. Instead of that, we're building the next generation of healthcare professionals with these expired supplies.
I'm in the Health Academy at Atherton, and SOS gives a lot of supplies. I've seen just how they've helped students learn firsthand in my classroom.
Healthcare is something that should be accessible to anybody. We are so lucky to have an organization like SOS here in Louisville, so we can do our part in bettering the world.
SOS is a lifeline, and we can't do this without them.
This is going to real people, and I've seen the difference it's made.
The SOS team's been in Ghana for the past week. We visited a number of hospitals and clinics just to get a feel for their medical needs.
SOS President and CEO Denise Sears and Director of Operations Demetrius Wingate traveled throughout Ghana and saw firsthand how SOS equipment and supplies are directly impacting communities and actively changing lives.
So thanks to the equipment that has come in, we have been able to fashion not 1, 2 operating rooms. The lab benefited in terms of the fridge, the phlebotomy chair, the supplies. There were consumables, syringes, and so on, and the microscope.
Nothing that came in was a waste.
The reason why we're here is how community came together.
Right.
I had ideas, I didn't have resources. And I think fundamental to this is just caring.
Caring leads to action, which leads to real impact. 5 years ago, the last time Denise was in Ghana, she met Anush, an 11-year-old boy who received a life-changing eye surgery thanks to supplies donated by SOS. While on her most recent trip to Ghana, Denise had the rare opportunity to meet back up with Anush and his father.
Anush, how are you? Oh my goodness.
It's just such an opportunity to see the full circle of our work. That supplies that arrived here 5 years ago are still changing someone's life.
Look at your smile.
It was just some supplies that SOS received, that volunteers packed, and that we shipped. Small gesture by hospitals, volunteers, and our staff, and this boy could see.
The stories of SOS impact both locally and overseas are countless, but the needs are just as urgent as ever. SOS is responding to the calls for help. We cannot do this without the support of our community. We need our donors. We need you. Together, we will answer the call for help, make our landscape greener for generations to come, support important local needs, and save the lives of children and families around the world.
Thank you, SOS.
Thank you, SOS.
Thank you, SOS.
Zikomo kwambiri, SOS.
Thank you, SOS.